Welcome to Building Healthy Connections, a space for healthcare professionals to understand how culture impacts healthcare. And now your host, Bertine Creveker-West.
Hello, and welcome to the next edition of Building Healthy Connections. I'm your host, Bertine Creveker-West. Welcome to our third episode in our series, 7 Common Values for the Healthcare Interpreter Code of Ethics. So during our last 2 episodes, we discussed the following code of ethics. The first one was accuracy, where we talked about keeping the meaning of the message as it was originally intended. Second one was advocacy, preserving the dignity and the rights of the LEP. The third was confidentiality, maintaining keeping everything private when we are at an assignment. The fourth was cultural competency, and that means getting to understand other cultures and knowing how they relate to the work that we're doing. And then there's impartiality, never taking either side. Remember, the healthcare interpreter is there to represent the LEP and the provider. So we're on both sides, not one side. So consider yourself Switzerland and be the neutral third party. So during today's third part of our series, we're going to wrap up by talking about 2 of the final codes of ethics. The first one is respect, and the second one is professionalism. Now, with regard to respect, you might be asking, well, that should be easy. All I have to do is walk in and be nice to everybody, smile, do my job, and leave. Actually, it's much more complicated than that. With regard to respect, not only do you have to walk in and smile and be polite and do your job and leave, but it's the manner in which we address each party. So in the LEP's culture, for instance, if they don't shake hands, then to be respectful would be to not shake hands, right? But if we're talking about the provider and the biomedical culture, to be respectful would be to shake hands. So how do you, the healthcare interpreter, meeting these 2 individuals for the first time, know how to navigate yourself? Well, first you would follow the lead of both individuals. So if I were to walk into a room, I would do my pre-session, of course, and I would respond in kind. So if the provider extended their hand to me to shake my hand, of course, I'm going to do that to the provider. But if I turn to the LEP and they bow their head down towards me or nod in my direction, I would also respond in kind. So that's me being respectful of both parties in 2 different ways. Also, with regard to respect, it's important to keep gender roles in mind. So the way that we would behave towards the opposite sex, meaning the way women might behave towards men, men might behave towards women, that also is dependent upon culture and the cultural lens of the 2 parties that you're serving. So that's why it's really important for interpreters to know the parties that they're going to serve. Even if you have some information about them, that would be great. Now, you won't always get this from your agencies. Sometimes you just have to show up for the job and make a quick determination. So you won't always be 100% correct. And that's all right, because we're not computers. So you have to really use your best judgment. And that's why these code of ethics exist, so they can help you navigate yourself from one situation to another. Now, as you can see, we're focusing on respect, but culture also plays a part in that. Cultural competency also plays a part in that. So as I told you guys in the beginning, these code of ethics, they go hand in hand. They are not separate ideas or entities. Each one is related to another. So you can think of them as children holding hands in a circle, or a chain that can't be broken. This way you know that one always has to do with the other. And sometimes you might be navigating a path with more than one code of ethic in mind. So with regard to respect, all of the things that we mentioned previously, accuracy, advocacy, confidentiality, cultural competency, impartiality, all of those things have to do with respect. So it's really important that we keep this in mind at all times. Now, also with regard to respect, it's important to address people in the formal manner. So again, as an example, for my Spanish speakers, you would use the usted version to address people rather than the tú, which is more familiar. You would also give deference to older people. So I think for Asian cultures, there's a manner in which you could refer to people. So for instance, let's use Vietnamese. If we were to interpret if we were present at an interpretation, it wouldn't be word for word, as I said, it would be meaning for meaning. But if you throw respect into that essential key piece of the code of ethics, you would probably, if you were interpreting for an older person, you'd probably say, Aunt would like this, that, and the other thing, as opposed to I would like, or Mrs. Gonzalez would like. You would defer to the person while you're still trying to interpret in the first person. And that is challenging. But again, this after time and practice and more practice, you'll get used to it and it'll become like second nature to you. Also, with regard to respect, it's really, really important for you to be respectful of the LEP family as well. This has a direct impact upon the relationship that you have with both parties, the provider and the LEP, but also it has a relationship it has a direct impact upon the relationship that the LEP and the provider have. So let me give you a quick example. You are interpreting in a hospital and you've done your pre-session and the LEP wants their entire family that they brought with him, let's say 10 people, because this has actually happened. So let's say you bring 10 people in with you. So now 10 people are speaking over each other because it's a family issue in many cultures. When a relative is sick, everyone goes to the hospital with them. And that can be a beautiful and wonderful thing. So we want to be respectful of that. So one thing that you would do, you'd introduce yourself to the family. You'd assure them that you're there to help their relative. And most of the time, families can either be LEPs themselves as well, or they can be they can be native English speakers, or they can speak English fluently. So a lot of times they might want to overstep the duties of the interpreter. And that's okay, only because they don't know what the interpreter does, which is why you would tell them what you're doing. And then you would help not control the information, but you would help control the flow of that information. So if the family's speaking over each other, you're not going to get agitated. You're not going to be disrespectful. You're not going to ignore them at all. What you would say is the interpreter needs for just the LEP to speak. So you would say something along the lines of, Mrs. Gonzalez has to be the only voice, or else the interpreter cannot help her. And the provider needs to hear that as well. So that's one way we can be respectful of the family. They can still be there. That's not a problem as long as she's fine with it. But if the LEP is not fine with it, then we'd have to have the provider dismiss the family. So don't take all of the responsibility onto yourself. The provider will tell you if they'd like that person present or not. Now, also, with regard to respect, we also have to remember, and a lot of times, novice interpreters, they want to protect the LEP and shield them from harm or bad news, but that's not our purpose there. The point of us being there is to really give the LEP all of the information that they need. Remember in our previous episode when we talked about a good healthcare outcome? A good healthcare outcome can only occur if the LEP has all of the information that they need, and that's all of the information that the provider gave them. Having said that, when a provider gives LEP any type of news, it's not up to the interpreter to determine if relaying that news is going to be helpful or harmful to them. By sheer virtue of us not relaying that news, that is harmful to them. In many cultures, people believe that if you give someone bad news, that's going to hasten their death. So let's say, particularly in the case of older people. So let's say, as an example, your grandmother goes in and, goodness forbid, the provider tells her that she is at risk for diabetes. Some families may see that as bad news and not want her to hear that, because that will hasten her towards diabetes, meaning that means she will get diabetes and she'll get sick from diabetes and perhaps die from diabetes. So something as simple as this, you can't keep that news from the person, and you can't make it sound nice. And a lot of times I hear interpreters say, well, there's a nice way to say it. There actually isn't. There's a kind and professional way to say it, and that is by rendering the message that the provider has given to its truest meaning. So that's when we're being respectful of the LEP and their wishes. Also, if an LEP opts not to receive a sort of treatment, let's say in the case of cancer diagnosis, it's really important for the for the interpreter to relay to the LEP what the provider has said as accurately as possible. So there we go again, pulling back to one of those previous code of ethics, accuracy. So the reason that this is important is that each LEP, each patient is an autonomous person. They have the right to make any decision that they want about not only their treatment, but from whom they receive treatment and how they receive treatment and where they receive treatment. There was an LEP some time ago that decided to, not seek chemotherapy here, but rather go back to Peru and go to the doctor that he had known for most of his life. Now, the provider was adamant against that. They thought they could provide the LEP with the best care that they could receive here. And then that interpreter that was present during that time, in a sense, felt they had some sort of decision to make. And really, there was no decision. All that you can do in a case like that is relay the provider's concerns, but also out of respect to both parties, you would have to relay the LEP's wishes, and that trumps everything. So the LEP ended up returning to Peru and getting care. Now, was that the best thing for the LEP to do? Yes, for the LEP and from their perspective. Was it the best from the provider's perspective? No, because that wasn't their professional recommendation. And keep in mind, the interpreter has no say in any of this. We have to remember that we are the linguistic expert and the cultural expert within that clinical appointment, but we have no say as to who goes where to do what for what. So in essence, though, if you think about it, wouldn't you, if you put yourself in the position of the LEP, wouldn't you feel better going to your doctor that you had always known, even if that means dismissing something a provider has said to you that you like? I think with regard to illness and curative measures, your state of mind is also very important. So better for that LEP to be at peace and at ease in their state of mind and go through treatment. They might have actually done better for it. Now, did that person recover? I don't know. But I do know that they went into their healing process feeling good about the choice that they had made. So the interpreter during that clinical encounter did the best thing that they could have done, and they stayed true to the code of ethics, particularly the one of respect. If we hadn't done that, then we would be breaching the code of ethics. So we have to remember that you may or may not agree with each and every decision a provider makes, each and every decision an LEP makes, but that's not our call. Our call is to ensure that these decisions are relayed to the proper parties. So this way, both people get exactly what they want. The provider gave a diagnosis that he thought was correct. The LEP decided how to proceed with the information that they were given. And all of that was thanks to the interpreter being respectful, being accurate. So again, these codes of ethics tie into one another. Now, before we go into our next code of ethic, which is professionalism, we'd like to take a moment to thank our sponsors. The West Linguistic Training Group, LLC, offers a variety of innovative training courses that promote corporate training, media, and school translation services, interpreter education, and mediation services. Visit their website at www.westgrouptraining.com. One Voice Medical Interpreters, providing high-quality and dynamic language solutions to organizations in the medical field to help them achieve a fluid communication and a better connection with their patients. Visit their website at www.onevoicemedical.com. And last but most definitely not least of our common values in the healthcare code of ethics is professionalism. Now, I should preface this by saying professionalism is like advocacy. We can talk about it for days and days and days and still never go over the same thing twice. But I'm going to give you the condensed version. Also, remember, check out our blog whenever you're done hearing this podcast, because then we'll have more detailed information on each of these codes of ethics. So with regard to professionalism, let's start out with the very first step that you take. When you first receive your assignment, the first thing you should do when you receive your assignment is make sure that you know the time, the date, and the type of assignment you're going to. This way you can prepare yourself prior to the assignment. Now, how are you going to do that? You're going to ask the agency that sent you the job. So that is as simple as, can you tell me what kind of facility this is? Or can you tell me what specialty the provider is? Meaning that, are they an oncologist? Are they a physical therapist? Are they a speech therapist? Will you be dealing with children? This way you'll know how to conduct yourself even before you get there. I should also add that this is a great way for you to go over your terminology before you get there. I know that I still have charts with terminology from my very first training class that I took years ago. And I carry these things with me to this day because there are couple of terms that I can never commit to memory. And so if I have this particular type of provider that I'm serving, I know that it's already in my briefcase. So I just carry it with me. And while I'm in the waiting room, I look it over very quickly to make sure that I try to remember those words as much as possible. So it's as simple as that. That's the first step you can take. The second step is to always be on time for the interpreting assignment and to know and become familiar with the organization or the hospital that you're going to go to. So one of the hospitals here, we're in Atlanta. So one of the hospitals here in Atlanta, they are awesome, but their parking is terrible. And I know this, and I found out the hard way. So I'm telling you this story so you don't have to find out the hard way. Make sure that when you go to an assignment, even if you are 15 minutes early for the assignment, which is the standard, that's the norm that we expect. So if the assignment is for 10 a.m., be there at 9:45. However, with this particular hospital, which shall remain nameless because they've got an amazing staff, so I'm not going to blame them for parking problems. But with this particular hospital, parking is especially bad. So I ended up looking for parking for an hour. And that was terrible. But one thing I knew to do was to call the agency that sent me, also call the hospital and let them know that I was there. I just couldn't find parking. So after going to that hospital several times, I made sure to show up as early as I possibly could. So every time I get an assignment for that hospital, I show up an hour and a half before the assignment because parking is very difficult there. Another thing about professionalism is accepting gifts. We can never, as interpreters, accept gifts from patients. It doesn't matter if it's a penny or $1 million. As good as the services we provided, we can't accept gifts from them at all. And there's a polite way to do this, but we'll talk about that more in our blog. One more thing before we wrap up with professionalism, always make sure that you have your dictionaries with you, be it hard copy or electronic. Always make sure to continue to educate yourself and go to any trainings that you can. Tune into blogs and podcasts and all of those things. Connect with your colleagues at interpreter organizations, healthcare interpreter organizations, medical translator organizations. And this way you'll always be kept abreast of what's going on in the field, and you can always make sure to consistently train yourself. So part of being a true professional is consistently training yourself and making sure that you are as prepared as possible. It is the job of the medical interpreter to be a constant student. That is the definition of professionalism. So thank you so much for tuning into this third part of our exciting series on the Code of Ethics for Healthcare Interpreters. Please continue to send us your questions. We love receiving them. And if you'd like to access this information, please read our blog. We look forward to seeing you in the next episode.
Thanks for listening to this episode. Stay connected through our website, www.buildhealthyconnections.com, or through our social media channels.